It's the PainExam Podcast with your host, David Rosenblum, MD. If you treat pain or have an interest in pain management, join us as we discuss painful disorders, alternative treatments, practice management, and more. Be sure to subscribe to the PainExam newsletter at PainExam.com and review the podcast on Stitcher or iTunes. Our high-yield premium episodes are now available on the PainExam app with a premium subscription, or access for free with a CME subscription at PainExam.com. And now, without further ado, here's your host, Dr. Rosenblum.
Okay, and welcome back. Really happy to be back here with you. It's been a little bit of a while since I last podcasted, and I have a few announcements. We're doing board tutoring now. We've had myself and some of our instructors have done private sessions for people who've struggled to pass the boards. We do an hour session where we go over questions as well as keywords, and we are finding the ABA outline to be quite helpful in guiding the review. So if you're interested, just reach out to us via the nrappain.org website. We're also doing our monthly ultrasound courses in New York and now in Costa Rica. So if you're looking to make your Costa Rica trip a business expense and learn some ultrasound guided interventional pain procedures or regional anesthesia, please reach out to me. The email is info@nrappain.org. Additionally, I'll be co-running the course at Aspen on regenerative medicine and ultrasound-guided pain procedures. It's in Miami in July. Hope to see you guys there, and lecturing at Pain Week in September. So, today I'm going to talk about NAD, or Nicotinamide Adenine Dinucleotide, which this is just one of those things like peptides everybody's talking about. And it's not mainstream, and I'm just trying to figure out, is this something I should be doing for myself as well as integrating into my practice? Anecdotally, I've heard a lot of good things, but it's not something that is part of the pain management board prep or the curriculum, yet there may be a very significant role in pain management as well as overall wellness. So NAD is a well-known electron carrier in the redox reactions, if you guys remember those. It's been studied a lot recently because of its role in intracellular signaling pathways, and it's an essential cofactor and substrate involved in a wide variety of key processes ranging from oxidative phosphorylation, ATP production, and immunological function and cell survival. NAD has been suggested as a possible therapeutic target for control of multiple pathological diseases, including age-associated disorders, neurodegenerative disease, and mental disorders. Levels of NAD, or NAD+, the oxidized form of NAD, decline across multiple tissues with age as a result of excessive DNA damage from free radical accumulation or ultraviolet exposure. The systemic decrease results in altered metabolic states and increased disease susceptibility. It's been predicted that restoring the NAD levels can promote general health and extend human lifespan. The hypothesis has prompted many studies, of which have shown NAD supplementation increased the body's resilience to many different diseases. And when I'm talking about NAD, I'm talking about NAD positive, or the redox, or the oxidized form. A host of NAD supplementation methods have been studied to date, including oral supplementation of NAD precursors such as vitamin B3, nicotinamide riboside, or NR, nicotinamide mononucleotide, NMN, and nicotinamide. However, as opposed to supplementation via oral means, IV administration of nutrients is known to result in higher serum concentrations, and additionally, attempts to increase levels available NAD via the ingestion of NAD precursors is highly dependent on enzyme-limited synthesis pathways. The physician-guided intervention, IV NAD supplementation is believed to provide a more direct and effective approach to resolving NAD decline. The family of NAD-dependent enzymes called the sirtuins play a central role in translation of NAD levels to regulate regulation of key cellular processes like metabolism, DNA repair, stress response, or chromatin remodeling. The deacetylase properties of the serotonin mediate broad functions involved the regulation of aging and longevity. In mammals, there are 7 serotonin families that function in various subcellular compartments. The activation of them generally triggers transcriptional pathways that enhance metabolic efficiency and upregulate resistance to oxidative stress. By increasing the antioxidant activity and activating DNA damage repair protein, serotonins have been shown to promote longevity, and longevity in organisms ranging from yeast to mice to mitigate diseases of aging in murine models. Poly-ADP ribose polymerases, or PARPs, PARPs, compose another category of enzymes that consume the NAD and repair DNA strand break in the nucleus. Conditions benefiting from NAD. Well, depression, which is a complex mood disorder and is associated with pathologies like inflammation, synaptic dysfunction, metabolic syndrome, and cognitive deficits, has been studied, and there are some promising results. SIRTs have been shown to suppress pro-inflammatory markers that are typical of patients with depression, such as interleukin-6, tumor necrosis factor alpha, and C-reactive protein. SIRTs might regulate sufficient levels of neurotransmitters commonly seen in depression by modulating their expression, secretion, and uptake. SIRT1 improves synaptic plasticity in depressive states. It's been shown that defects in SIRT1 activity can be reversed by supplementation with NAD precursors, suggesting manipulation of the sirtuins via NAD may be a therapeutic solution for depression. In terms of pain syndromes and inflammation, which is very relevant to us, every pain syndrome is associated with a set of inflammatory mediators. Thus, the key to treating pain conditions associated with pain is thought to lie in understanding the inflammatory profiles and subsequently inhibiting or suppressing the production of inflammatory mediators. Conditions such as arthritis, back and neck pain, fibromyalgia, migraine, neuropathic pain, complex regional pain syndrome, bursitis shoulder pain, and many more have been treated by limiting inflammatory areas. There is growing evidence that NAD is involved in anti-inflammatory processes, and a study performed by El Hossan et al. Linked oral supplementation of NR to depress circulating levels of inflammatory cytokines such as IL-6, 5, 2, TNF-alpha, and furthermore, in murine models, treatment with NMN for time periods as low as 1 week caused a reduction in the expression of TNF-alpha and interleukin-6 in skeletal muscle. And just to remind you, NMN is the nicotinamide mononucleotide, and the NR is nicotinamide riboside, in case you forgot that. So, skeletal function. Well, many studies previously reported a progressive age-dependent decline in oxidative phosphorylation efficiency in skeletal muscles. Mitochondrial dysfunction of this form manifests as muscle atrophy, inflammation, as well as impaired insulin signaling and glucose uptake. In studies performed by Gomes, treatment of old mice with NAD precursors dramatically improved muscle function by increasing mitochondrial efficiency, increasing ATP production, reducing inflammation, and influencing muscle composition. Similarly, improving mitochondrial function has been demonstrated to increase mitochondrial efficiency, increasing ATP production, reducing inflammation, and influencing muscle composition. Similarly, improving mitochondrial function has demonstrated increases of oxidative metabolism in muscle, thereby increasing endurance, thermogenic capacity, and recovery from muscle injury. NR also increases the quantity and quality of muscle stem cells and enhances muscle regeneration in elderly mice by preventing MUSC senescence, that's muscle stem cell senescence. For individuals affected with muscular dystrophy, supplementation of NR is known to improve mobility, reduce percentage of detached muscle fibers in C. elegans and zebrafish models, respectively. So longevity and aging. The steady decline in total NAD levels over time is a common phenomenon that occurs naturally for all organisms. The decrease parallels a progressive decline in mitochondrial function that leads to age-related changes and pathologies. Considering the vital role of NAD in oxidative phosphorylation and mitochondrial homeostasis, it follows that restoring NAD levels in diseased and aged animals can extend productive lifespan. In models of mice with accelerated aging phenotypes, raising NAD levels have also been shown to be effective in extending lifespan. Treatment of elderly mice has shown to extend the lifespan by up to 58% in some studies. Supplementation of NAD precursors initiated in younger age have been observed to increase activity, improve insulin sensitivity, and yield greater bone density, ultimately delaying aging and age-related decline. Hallmark of aging is decrease in neurofunctional and impaired cognitive behaviors, often manifested as neurodegenerative disorders such as Alzheimer's. NAD precursors such as NMR and NR have been demonstrated to be effective in improving multiple aspects of the neurodegenerative disease. So basically, this, I'm going to give you guys the article I'm reading from, which is really interesting and a nice summary, but really there's absolutely no mention of side effects or nothing negative about NAD. So let me dive into common reactions. Generally, this is safe, but patients may complain of nausea, stomach cramps, headaches, flushing, and temporary fatigue. These are usually mild and tied to high doses and quick administration via IV. So the way you manage that is just slow down the drip. You could take, if you take the oral supplements of NR, NMR, and NADH, there's common side effects of bloating, diarrhea, nausea, indigestion, and muscle cramps. Rare and serious side effects include liver function, temporary increases in liver enzymes that have been observed. High doses may cause decreased insulin sensitivity in certain individuals. Cancer concerns, because NAD fuels cellular energy, there's theoretical concerns that could accelerate growth of existing tumors. So you should be cautious if you're pregnant, nursing, history of liver disease, metabolic disorders, active cancers. The disclaimer is be smart. I'm not telling you to go out and do this stuff. I'm just reading you what I found on the internet. And once again, NAD is not FDA approved for any clinical indication. So be cautious with that. But lack of formal approval does not mean that it's not safe. And does not mean that it's not therapeutic. It just means that they didn't approve it. So there are plenty of things that they did approve in the FDA that have side effects. So it's not, it's something to just be cautious with when you're prescribing it for other patients. And I'm currently not prescribing it, but it's something I would consider based on the research I'm currently doing on this substance. Anyway, thanks for listening. It's board prep season. If you guys are interested, go to nrappain.org for your pain management board prep. Hope to see you guys at the conferences and at the ultrasound courses. And if you're interested in any of the previous tutoring or courses, arranging a private course in Costa Rica or elsewhere, just reach out to me. Hope you guys are doing well, and best of luck.
Dr. Rosenblum is here solely to educate, and you are solely responsible for all your decisions and actions in response to any information contained herein. These podcasts are not intended as a substitute for the medical advice of a physician to a particular patient or specific ailment. You should regularly consult a physician in matters relating to yours or another's health. You understand that this podcast is not intended as a substitute for consultation with a licensed medical professional. Copyright 2017, David Rosenblum, all rights reserved. No part of this publication may be reproduced, stored in a retrieval system, or transmitted in any form or by any means, electronic, mechanical, recording, or otherwise, without the prior written permission of the author.